listener, welcome back to MedSynapse podcast. Today we'll invade new medical condition. It's not only a skin condition or like any skin condition, it's alopecia areata, which is a very crucial medical condition. So what they create a whole month for patient awareness related to alopecia areata. Today we will have all details from diagnosis and defining good management of alopecia areata with our guidance. With guidance of Dr. Enas Attia. She is not only consultant, is also professor and dermatology consultant. Welcome, Dr. Enas.
Thank you.
Thank you for having you today, Dr. Enas. Today we will have a very crucial topic, which is alopecia areata. Firstly, I need to ask if you can define us alopecia areata and the clinical presentation for it.
Well, alopecia areata, it's an immunological condition with autoimmune disorder against the hair follicle. It will appear as a patch or a spot without any hair, without any inflammation. This is the usual. Or it will take the whole body, or it will take another distribution, like taking a band behind the ears, or sometimes a band in the front of the scalp.
Great. So, Dr. Enas, what is the underlying pathophysiology of alopecia areata, and is there a genetic predisposition?
Yes, as I explained, it's an immunological condition, but also there is genetic background. So it's likely that we will find some families, they have like siblings have alopecia areata, or a mother or a father and have their son or daughter having alopecia areata. Also, as it is immunological condition, so sometimes it is associated with other immunological conditions. For example, we will find some patients, they will have thyroid problem, they will have diabetes type 1, they will have atopic dermatitis or eczema, psoriasis, vitiligo, like this.
Great. So, Dr. Enas, alopecia areata can manifest in various forms. Can you describe the different clinical variants and their severities?
As I explained, the most common is the alopecia areata, which is the vulgaris or the common type, which is small patches. But there are other forms, the alopecia totalis, which takes all the hair from the scalp, and the alopecia universalis, in which the hair is lost from all the euphiasis, which is loss of the hair from a band behind the ears and on the occipital scalp. Also the euphiasis inversa, which is manifested as a band of loss of hair in the front of the scalp, and it's very common that it will be misdiagnosed with the frontal fibrosing alopecia. And there is a very rare type, which is the diffuse type, which the alopecia areata will come in a diffuse loss of hair, resembling effluvium, affecting the whole scalp, but not in a patchy distribution. And sometimes we notice that the hair will become gray at first. This manifestation is called Marie Antoinette sign, because Marie Antoinette has all graying of the hair all of a sudden, because she had the diffuse alopecia areata. And if you remember, Barbara Bush, she had the same after a psychic trauma of loss of her son or something.
Yes, exactly. So, Dr. Enas, alopecia areata from the most aggressive medical conditions ever. So, what are the available treatment options for alopecia areata?
Of course, if it is newly diagnosed and it is small patches, we can treat with topical treatments. Of course, the steroid and topical immune modulators are on the top. And if it is not responding to the topical treatment, we can go to intralesional injection of corticosteroid. Or from the start, if it is in the beard area or in a very showy area on the scalp, and the patient wants to get fast response, we can do from the start intralesional injection. The problem comes with the severe forms, because in severe forms, they will need immune suppression or immune modulation system. Nowadays there is the treatment by biologics, but it's not that famous and it's expensive, and it's not also covered by all insurances. So this is a dilemma in the treatment or the management. And going to the immune suppression, the systemic immune suppression we used to use before, like the systemic corticosteroids or the immune suppressives such as the methotrexate or cyclosporin. So this is not good really that we will do systemic immune suppression for such a condition, and the patient will be exposed to much side effects from these treatments. From my side, I prefer to give, if the patient cannot pay or his insurance will not cover for the biologic treatment, I prefer to give the cyclic treatment, like giving the oral mini-pulse steroid therapy, which is effective in some cases and will not expose the patient to much side effects as the regular intake of daily steroid.
Great. Dr. Enas, you already mentioned a lot about biologic treatments. So are there any promising new treatments or research area in alopecia areata?
Yes. In the biologic treatments, particularly with JAK inhibitors, there is too much research going on, and I believe many will be in the pipeline and will be in the market soon.
Great. So, Dr. Enas, unfortunately, alopecia areata affects lifestyle for all patients. So, alopecia can significantly affect patient quality of life. How do you address the emotional and the psychological and psychosocial impact of this condition?
It's a very great question, because the psychological impact, it can be a cause and it can be a result. Stress and psychological trauma is reported to be a cause of inducing alopecia areata. And also because alopecia areata affects a very important part of the human body related to the self-esteem and to the physical appearance, which is the hair. So it really affects the psychological status of the patient. They will need psychological support from the family, of course, and we can advise them about camouflage, because during the journey of the treatment, it will take time. So many of the patients, we advise them about camouflaging by hairstyling or by putting some powders which will give a color to the area that it is approximately the color of their hair, or wigs in case of alopecia totalis. So we advise about this so the patient can overcome the psychological burden.
Great. So, Dr. Enas, we can't mention immunology and the skin condition without mentioning stress management and lifestyle. So, can lifestyle factors and stress management influence alopecia areata?
Of course, because as we said, stress can induce alopecia areata and can worsen alopecia areata, and also can have an impact on the response to the treatment. Also the lifestyle, because some cases of the alopecia areata was reported that they have mineral and vitamin deficiencies, such as folic acid, zinc deficiency, iron deficiency, and this also will affect the treatment response. So a healthy lifestyle and a balanced social life, it's the way to support the treatment.
Great. And finally, which will be related to patient awareness, how can patients prevent relapses and manage chronic alopecia areata?
Actually, this is the patients cannot go through the journey of alopecia areata without the support, psychological and medical support. And if the patient understands his condition and that it is immunological and related to stress and lifestyle, this all goes together with positive response to the treatment.
Great. And finally, Dr. Enas, if you'd like to add any tips and tricks for patient awareness and the physician to handle patients with alopecia areata, please do it.
Okay, many patients will ask, is this contagious? No, it's not contagious, because they will be confused if this is tinea capitis. No, tinea capitis is another condition which is infection, and usually likely fungal infection from ticks, and there is signs of inflammation in the scalp or the area affected by tinea capitis. scaling, redness. So this we don't see in alopecia areata. Another thing, that if the patient feels pain in the hair, like many patients will tell me that I have burning on the scalp, I feel pain in my scalp, I feel tension on my hair. This is a bad sign. If you feel like this and you had a history before of alopecia areata, this is an alarming sign that maybe it's coming back. Or if you have already alopecia areata, this is an alarming sign that it can be expanding, so you have to visit your doctor.
And finally, I need to thank you so much, Dr. Enas, for sharing your experience. It's wide experience as well, not only just a practical experience. So I'm really thank you so much for your time and having you today on my side. Thank you so much.
Thank you so much. It's an honor.
Thank you.